Hello, everyone. We are live. Welcome to the Girlfriend Doctor Daily Lives. I am here today with my dear friend, Dr. Ellie Campbell, and we're going to talk about immune boosting strategy. So while you guys are coming on, be sure at my main page at Dr. Anna C. First of all, I want to welcome you all here for joining us. And I also want you to share this important message, the messages that we're sharing today. Integrative therapies to help boost our immunity, and what's being done well, what's being done successfully, even in clients who have been contracted the COVID-19, or the coronavirus that we're currently dealing with. So excited to talk and share this information. Be sure to share, start a watch party, tag people you know that have to listen to this. So bringing on my dear friend, here we go, Dr. Ellie Campbell. Ellie, thank you so much for joining us out of your busy schedule today. Oh, can't hear you. Check at the bottom that you have your correct mic on. And let's see.
Again, is it better? Can you hear me now?
That is so much better. Perfect. I can now hear you. And are you sitting out in your backyard?
I am.
I hear the birds. That's beautiful. So, well, we're welcoming people on. We're here today with my Facebook Live community, my YouTube Live community, and sharing the brilliant Dr. Ellie Campbell with each and every one of you today. Now, some backstory. I met Dr. Campbell when Ava Marie was only a few months old. I was lecturing in Atlanta, and I was breastfeeding, so I took Ava with me. She came to my lectures, and I was lecturing for a company, Metametrics, now Genova Diagnostics.
Right.
And Ellie had the most insightful questions, and we knew we were friends for life from that point on.
And we've traveled the world together, so yeah.
And we've lectured in Brazil and gosh, all over. So Dr. Campbell, share with our audience a little bit about your background, and also, where you are, where you're practicing right now. And then also like you to share how you pivoted in your practice. Y'all, I'm drinking a keto green chocolate shake made by Ava Marie. She added extra cocoa in it. And so she brought it over to me for my call. I've been doing calls all day. So I will be sharing while you share.
Yeah, so I'm Ellie Campbell. I'm board certified in family medicine and integrative holistic medicine. I've been practicing, I guess, about 30 years now, a little over 30 years. And about 2/3 of that has been in an integrative model, because I realized, following the best evidence-based guidelines of the experts in their industries, my patients really weren't getting better. I was putting a lot of medicine on a lot of patients, and their outcomes may have prevented some diseases, but I certainly may have prevented some complications, but I didn't really reverse any diseases. And so I started looking for a better way. And that way, of course, is integrative and functional medicine. Get to the root cause of what it is that's making the patient sick and fix it, and their wellness will shine through. So that's what I've been doing for the last 20 years, I guess. And 15 of that, I've been in a solo concierge style practice in suburban Atlanta, Cumming, Georgia. So my practice has been membership based only. Before that was cool. So patients pay me not for service, not on a onesie basis, but they pay me for their care over the longitudinal time, a minimum of 6 months. And most patients, it's a year at a time. So during that time, I can really get to be face-to-face with the patient to understand what they need, what their nuances of why they're not getting over the health humps that they need to get over. But coronavirus put a crimp in that. And so we had to pivot pretty rapidly and utilize a lot of technology to our advantage. We started doing telemedicine visits much more frequently. We've always done a little bit of telemedicine. I have patients from Trinidad and Tobago. I have patients from Korea. I have patients from Canada. So sometimes we do telemedicine. But now I'm doing telemedicine from people that live 2 miles up the road, because it's sometimes not safe for them to get out, or sometimes they just feel uncomfortable to be out in the community. And so we respect that. And we can easily schedule a Zoom patient visit to do prescription medicine refills. We've also done a little bit of care in cars. That's a new thing for me.
Drive-up evaluations.
Drive-up evaluations. That's a new one for me. So we've done a little bit of that, and a lot of telephone medicine, a lot of email medicine, and a lot of refills for chronic prescriptions without being seen. So that's somewhat unusual for us. You know, we like to be in touch with our patients. We like to I like to put my hands on their pulses, and I like to feel the temperature of their feet and their skin. And I like to look in their eyes and their ears and their throats and talk to them about what's going on. And that's a little bit harder to do some of that evaluation from telemedicine. Although I'll tell you, I've been getting a lot of text pictures of dermatitis. That's a new thing too, teledermatitis.
Well, from a gynecologist point of view, I mean, it can be. I've done that. Yeah. I mean, regardless, way before. So, so it is true. We've got some great questions coming on, and I want to thank you guys from at Dr. Anna C at the main page. Share this, tag people. You can't tag it from my private groups, but you can tag, and then encourage you to share this information. I'm going to go ahead and share my screen, Ellie, and we'll just talk about progression of coronavirus. And for everyone who's listening, again, I want to, we're going to focus on a few things, just being aware symptomatology-wise, because Dr. Campbell knows that I got some IgM and IgG antibody testing. And I've had many people say, well, I think I had it back in January or back in February, and I was really sick. And for me, I brought my daughter from the Netherlands, from Holland, where she was studying. And and so we were, you know, I was concerned that maybe she had it. She had at some point, she had some fever. We were all quarantined, and you just start thinking, did I have it? Did I not have it? So out of, I had 20 tests, and out of everyone I tested, everyone was negative. And so this is interesting because I haven't tested confirmed COVID positive yet, but it just brings up, okay, you know, there are many different strains of the flu virus. We know this coronavirus, COVID, this coronavirus, COVID, what number are we?
SARS-CoV-2, COVID-19.
COVID-19. So that it has mutated. So I wanted to kind of share some of the progression. So I'm going to share this screen and we'll talk through it and just share. Oh yeah. As I was saying, we're going to share some of the symptomatology, the progression, what to do, you know, whether we think we've had it or not, how to boost our immune system, what we do as integrative medicine physicians, what we ourselves are doing, and what we're recommending to our clients when we hear someone sick, getting sick. I mean, we've been doing this for decades. As first signs of flu, you come in, we'll bolus you with this, that, and the other thing. And, you know, before, here's a prescription. If you're not better in 3 days, take the prescription. Right? I mean, that's how we do it in integrative medicine. So we're going to share some of that. But again, always, we are not giving medical advice. We are giving information to educate, inspire you. And then always your care is between you and your physician. If you're not getting the care you need, that's where we shift. But ultimately, we are responsible for our own health. And that's what we are giving you knowledge to help you make good health decisions, because now more than ever, we want to be as healthy as possible. So you guys should be able to see my screen here. Just this incubation period, the stages of the coronavirus SARS-CoV-2 infection. Ellie, you want to talk about this a little bit?
Yeah. So when people get sick, obviously the virus has been in their body for a short period of time before they actually get sick. It is during that time when the virus is replicating that they are actually quite contagious, and they may not even have symptoms yet. This is where I think the misnomer of the asymptomatic patient comes in, because the vast majority of patients are not truly asymptomatic. They're actually pre-symptomatic. In other words, they're about to be sick. They just don't know it yet. And so if you look at that graph, day 1 is the first day that you got infected. Those viruses are now in your respiratory system if you don't have a strong enough immune system to fight it off. And we'll talk about some ways that you can do this. This virus doesn't jump out of the bushes and get you. This virus can be dramatically reduced if you have a strong immune system. But if it's for whatever reason weakened and the virus begins to replicate, somewhere around day 5, you typically start with your first symptoms. And for most folks, that is a fever, a general sense of I don't feel well, and a cough. Shortness of breath doesn't typically begin for most people until somewhere between day 7 to 11 or so. So here in Georgia, we cannot generally get a test without fever, cough, and shortness of breath. Those are the 3 primary symptoms. There are lesser known symptoms that happen, and those include headache and diarrhea and muscle aches and an odd kind of nasal congestion that most people say is unusual and they've never quite felt before, and a feeling that I've never been this sick before. So, should you have fever, cough, and shortness of breath, you should call your physician or call, here in Georgia, we have the CVS Minute Clinics. They will do a pre-screening evaluation for you. And if you have enough symptoms of concern, they'll direct you to a drive-up screening test center where you will have a deep nasopharyngeal swab to be tested for the presence of the virus. That test at this time is free, paid for by your federal government. And so we have a, oops, I lost your screen, darling.
Sorry, there we go.
So if you have a screening test that shows that you have the virus, they will now ask you to go home unless your oxygen level is below 93, in some cases 95. But if it's below 90, above 93, they'll tell you to go home, convalesce in place. The odds are well in your favor. 85, 95% of patients who get coronavirus have mild to moderate symptoms and will do better to go home than to go to the hospital. Why? Because conventional medicine has nothing to offer you. The only thing they can give you is nasal oxygen and maybe some IV fluids, which they're now generally not doing because too many fluids can make water in your lungs and make it harder for you to breathe. So all they do is watch you, and that's a very expensive place to be watched. We have in functional medicine said for decades that healthcare is self-care, and it has never been more obvious. Coronavirus is holding a magnifying mirror to us to believe that healthcare truly is self-care. And so if they send you home, we have a list of things you should do.
Yeah.
All right.
And definitely there was this question came in now. Dr. Ellie Campbell, we call her the superwoman of vitamin D for a reason. I mean, when did we lecture in Brazil? Because we brought this there, man, and you had your superwoman cape and everything, your vitamin D. I mean, this is 13 years ago, I think. I mean, 13 years ago. And that's too, we were testing vitamin D levels and checking vitamin D. And listen, y'all, when you think your insurance ought to be paying for you, this is when the insurance company called me from the big blues and said, Dr. Anna, there's no reason you should be retesting vitamin D levels. I'm like, yeah, they were low. And we need to see when we get to a therapeutic level. And they're like, well, there's no reason that's fraud. And because we're federal, blah, 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 that's considered a government fraud if you do that. So let me just tell you about the insurance company and how they test. True story, y'all. So it is really important that if your insurance company is not giving you testing or whatever the situation may be, that you are self-testing. You are in charge of your body and you're responsible for it. I mean, this is the reality. And so we can't, that's a whole nother discussion, but let's talk about vitamin D. Karen's been sharing our talk here with everyone. Thank you, Karen. I acknowledge you for that. That's awesome. Karen writes, I'd love more information on which type of vitamin D3 to take. Some are saying K2 is not needed to be included with a vitamin D supplement because K2 is easily obtained in greens. But others say we need D with K2. I am that other that says
we're the others.
D3K2. Vitamin D says deposit calcium. Vitamin K says where. I'm going to fix my lighting while you're talking, Ellie. Go ahead.
Okay, good. Yeah. So vitamin D is actually a hormone, a prohormone. And so it's made in one place in your body and has effects everywhere else. Vitamin D affects your blood sugar. it affects your blood pressure, it affects your immune system, and it affects your bones and your calcium metabolism. So that's only one of the many ways that it works. Vitamin D is actually one leg of a three-legged stool. And on those three legs are vitamin A, vitamin D, and vitamin K. Vitamin K as K2, vitamin MK7 is the type of K2. So the K1 is the kind of vitamin K that you get from supplemental greens in your diet. K2 you get from other things like certain cheeses, fermented soybeans, a few other hard to get places in the average American diet. So we have three legs of a three-legged stool that support the metabolism of magnesium and calcium. And so without vitamin A, your vitamin K and your vitamin D don't work. Without vitamin A, your K and your D don't work. So you really need all three. And so how much does it take? Well, that's a great question. And the only way to know is to test, treat, and retest. For most of my patients in my practice, that's approximately 5,000 international units a day to get a serum vitamin D level up somewhere between 55 and 80. We don't have much evidence that levels above 80 help. There's some hint that maybe in some cancers, it may not be a good idea to be above 80, but a level between 55 and 80 is crucial. A level between 32 and 50 is actually probably dangerous. So don't take just a little bit of vitamin D. And the reason for that, this comes from Dr. Cannell, who's the chairman of the Vitamin D Council. And there's this thing called cytokine storm that happens in both influenza and in coronavirus. Cytokine storm happens when your immune system goes on the rampage so hard to try to kill that invader that it also kills the human being that has the infection as well. It causes severe multi-system organ failure and pulmonary edema. And when we get this cytokine storm, it is dampened by certain molecules that vitamin D can make. They're called cathelicidins. They're your natural antibiotics. And vitamin D helps support that. If you have enough vitamin D, you can prevent cytokine storm. If you don't have any vitamin D and your immune system is really weak, you don't have much of an immune system at all. It sort of peters out. It doesn't really fight very strongly. So you may end up with an infection and very little immune reaction. You might or might not recover from the infection, but you're not going to have a cytokine storm. It's the in-between levels where you're greatest risk. So we recommend that you take 5,000 units every day and get your blood level checked. If you have not had a blood level checked and you think you have coronavirus, you're coughing, you're short of breath, you've been to the drive-through clinic, they've swabbed your nose, it felt like they tickled your brain, but they got a good specimen, and now you know you have coronavirus, and they told you to go home and convalesce, I'm going to recommend that you go home and get 20 pills of your 5,000 international units of vitamin D. You're going to take 100,000 units a day for 2 or 3 days. We call it the vitamin D Z pack in my office, and we've been using this for 13 years.
Yep. Yep. And we were doing early injections. If you were to come into our office, we would have done an injection of a high amount of vitamin D3. Our patients have all received that if their vitamin D levels were seriously low, if they had severe osteoporosis, if they were sick, if they had cancer, we did a lot of that as well. I do, my vitamin D3 K2 is 10,000 IUs. So it's 10 of those. Don't take 20 of those. So if you have the Pura DK combination, that's 10,000 IUs in each of those. So that would be at those early signs 10, but right now I'm saying 1 a day. We're going to get up to those optimal levels and at some point check your vitamin D, 25 hydroxy vitamin D levels. Often look at those units because often clients will go to the store and they'll get 500 IUs or 1,000 IUs. So again, look at what you're getting. Always want to get the highest quality, and the combination, like Dr. Campbell said, D3K2 is critical.
And the one I take is D3K2 and A, vitamin A, at 5,000 units a day. So I would also take 5,000 of A. If I got sick with coronavirus, I would take 100,000 units of vitamin A for 2 or 3 days and not more. In fact, this is a little, as well as vitamin D3, as well as K2. It's a little known fact. If you go to the World Health Organization's website and you look at the treatment for measles, another virus, it's not a coronavirus, but it is a viral infection, one of the most contagious diseases on our planet. They recommend that in rural communities, the treatment for measles is 100,000 units of vitamin A for 2 days. So here, the World Health Organization uses vitamins as a treatment. Well, we've been doing that in integrative medicine forever. Mm-hmm. And so here is another opportunity, if we were sick, to kick up that vitamin A, kick up that vitamin D if you're sick. And then when you're well, get your blood level checked and see how you're doing. We've treated hundreds of thousands of units in my practice. We've never seen a problem. In theory, you can overdose on vitamin D and vitamin A because they are fat soluble. But if you do this pulse dosing for a very short period of time, just for an acute illness, you're not going to get into any trouble. We've never seen it.
Ellie, I haven't seen it either. Have you ever seen too high of a level of vitamin D?
No, the way that vitamin D causes trouble is by causing a high calcium level. There are a couple of cases where you are likely to get into trouble. I've never seen these cases, so I've never got into trouble. You can get high calcium when your 125 hydroxy vitamin D is over converted into 125 hydroxy, and those conditions are tuberculosis and sarcoidosis. If patients have those conditions, they would be much more cautious with the use of vitamin D in illness. There is some rumors going around that you should not use vitamin D in coronavirus. It's malpractice to use vitamin D in coronavirus. And when I looked at those zealots who were reporting that and pulled out the literature that they were claiming that supported that statement, there were 2 studies in test tubes in white blood cells that were tuberculosis infected. So here is this odd circumstance where there's an aberrant pathway where vitamin D does not behave normally. So I, with abandon, can recommend high-dose vitamin D, and I think those people don't know what they're talking about. Haven't used it like we have for 13, 15 years.
Right, exactly true. Again, using it clinically in fragile clients. And so always the case, with the vitamin K. Again, there's some good questions here. Karen said, so do we take vitamin A supplement or can we get that from a food source? Definitely foods rich in vitamin A include our favorite carrots, right? And you're gonna definitely wanna do that. Do a little bit of carrots in your keto green, but also greens are really rich in vitamin A and K2. So, but at the first sign of illness, I certainly would take a vitamin A supplement. I'm supplementing right now. The supplement I'm using to get my adequate doses of zinc, we'll talk about that in a minute, to keep my baseline up of vitamin D is it's my Vita hair, eyes, and skin formula. It has A, zinc, and D, and a couple other things to keep hair healthy. At times of stress, I lose hair. So amongst other things, keeping my immune system strong and my hair strong. What about you, Dr. Campbell?
Yeah, so Miss Karen, if that's your picture, my guess is you've had enough birthdays that you're in a higher risk category. So I would strongly recommend supplementing. As coronavirus sort of fades into the regular seasonal viruses that we have a flu season, we have a cold and flu season, coronavirus, there's many other coronaviruses that cause the common cold. And I think we're going to be dealing with this for a long time. When it comes to cold and flu season, I would supplement with vitamin A. I would not depend on my farmers to put enough in their soil that my plants get it, that I eat it and get enough to really boost my immune system. I would supplement during the season, the illness season.
Yeah, absolutely. Okay, good. And so we're going to talk about, so we've talked about vitamin D with vitamin K. We talk about vitamin A. I briefly alluded to zinc. That's another one, and zinc and vitamin C. So let's hit on those.
Yeah. So if there's only one supplement that you could afford, the number one most important supplement during coronavirus epidemic, in my opinion, is zinc. And the reason for that is because there's an enzyme called the RNA-dependent RNA transcriptase. It's a copy machine that the virus uses to make baby viruses. And that enzyme requires a ton of zinc in order to, I'm sorry, I said that wrong. That enzyme is inhibited by zinc. So if you are trying to block that replication, your body is going through a ton of zinc. It's burning through zinc to stop this replication, to stop this virus from making babies. So you have to have a lot of zinc on board, and many of us are modestly zinc deficient. Guess what the symptoms of zinc deficiency are? Hair loss, loss of taste and smell, low-grade fever, cough, and shortness of breath.
Exactly. Always zinc deficiency, loss of smell. Always associate that loss of taste, loss of smell, zinc deficiency. So how is it causing that?
Right. So it's because the coronavirus, the body is working so hard to use that zinc to stop the replication. Your body's zinc levels are dropping. So if you don't have a good, healthy crop of zinc in your body, you're not going to be able to fight the coronavirus, and you're going to lose your taste, sense, and smell. So this is a good symptom for us to recognize, because if you don't have cough, don't have shortness of breath, don't have fever, then you lose your sense of taste and smell. You're thinking, oh my gosh, this could be coronavirus. I better be in, kick my vitamin A, kick my vitamin D, kick my zinc, kick my vitamin C, and make sure that I have all the nutrients that my immune system needs, because the more resilient your immune system is, the better you can fight this off.
Yes. Yeah. And I want to talk more about that too. We'll go into some others, but we hit on vitamin C, zinc, D, and A. And again, really critical. Shelley asked, can drinking hot liquids actually wash it away into your stomach where it can't survive?
That's not true. The liquids would have to be so hot that they would scald your tongue and throat. So not hot enough.
Yeah. So in general, though, that drinking lemon water, hot tea with lemon, hot liquids in general are going to keep you from forming mucus, and they're just a good wash away. But again, hydration is very important. Alkalinization is very important. Now, my listeners know this, right? You guys can go talk on how important alkalinization is. Actually, Ellie, did you see that paper on Angeli sent it to us? On the avian coronavirus and acidity being a key risk factor in viral replication?
Yeah, I think I did read that paper. And it basically said that the more acidic the environment is, the easier the virus can make babies. So we don't want to be acid. Acid is for batteries. People do better when we're alkaline.
Test, don't gas. Check your urine pH. Check your urine pH. Check your urine pH. Check your urine pH. Karen says, what's a trusted A supplement? So hard to find a trusted source. I know for myself, I use Zymogen, Xymogen. I use Designs for Health. The product on my website is the hair, skin, and nails that has the vitamin A that I use in it. But Thorne is another good source of vitamin A.
We like Nutritional Frontiers, and Ben Lynch has a nice one too. He has a micellized vitamin A drop. So yeah, it's like his is like 5,000 units per drop. So it only takes one little tiny drop to get your daily support.
I love that. Donna asks, sarcoidosis, why not vitamin D?
Because of an aberrant pathway, a genetic mutation in those sarcoid cells that takes vitamin D and makes it into a super vitamin D called 125 hydroxyvitamin D. That super vitamin D takes calcium out of the kidneys at an accelerated rate and can deposit it in places it shouldn't be, like your coronary arteries, kidney stones, gallstones, and not in your bones where it belongs. So How much zinc? 20 milligrams a day for prevention. Should you get sick, 20 milligrams 4 times a day?
Yeah. I think on a regular basis, because for me, the stress-induced hair loss, I typically average, 40 units. If I'm experiencing hair loss, I'm at 60, but I agree, baseline at 20 a day, and then C, right?
Vitamin C.
We don't just look at, but also at some point, especially if you're doing high dose C, when you get lab tested, we want to look at red blood cell zinc. That's different from serum levels, red blood cell zinc, in the future for testing and looking at your actual red blood cell zinc levels. I want to thank you guys for sharing, and I want to honor Dr. Campbell's time. Do you still have a few more minutes to get?
I can give you about 10 more minutes. Yeah.
I will take them. You guys will take them, right? Please give a shout out to Dr. Campbell. Tell her thank you. Her Facebook page is Campbell, like the soup, Campbell Family Med. And I put her website in the chat here, so you guys can go to campbellfamilymedicine.com. She's a concierge physician, my go-to gal for me and my family, and she is in north of Atlanta right now. So we have Jean, one of our favorites. She's one of our magic menopause ladies. She is a superstar. She says, I love the conversation with Dr. Anna and Dr. Ellie during our magic menopause in 2018. And first heard of the flu bomb or Z-Pack with supplements. It has served me so well. Thank you. I will replay this over and take detailed notes on this expanded talk. Thank you so much, ladies. I used Dr. Anna's Vita Hair along with a zinc supplement, and Hub said just today after vacuuming and emptying it, and he yelled, your hair has definitely stopped shedding.
Yeah.
Well, tell him, thank you. That is awesome. And he is vacuuming. That is porn for women. Oh my God, that's hysterical. I love that. Just tell him I said that. I'm looking for I have a book called Porn for Women somewhere. This is so funny. We are off subject, but laughter is medicine. You see, right on the cover, Jean, this could be your husband right there. See? Look at that. Isn't that great? All right. So let's go into more. So we talked vitamin D, vitamin A, zinc, vitamin C. That's a standard, 2,000 to 4,000 IUs. First signs of illness
go up. So as much as, we call this the vitamin C flush. Your body has a natural way of telling you that it's gotten enough vitamin C, and you will empty your bowels much like you've had a laxative. So we recommend that you start taking 1,000 milligrams of vitamin C an hour when you get coronavirus. And if you happen to have access to a doctor who can give you IV vitamin C, that's what we do. That's what they were doing in China. That's what they've been doing in the intensive care units in New York. That's what they're doing here in the intensive care unit in Atlanta, giving IV vitamin C. In our opinion, they're not using enough. They're using a dosage somewhere around 6 to 12 grams in a day. We usually give 25 grams IV, and I've given as much as 100 grams IV. Takes 3 hours to do that. It's a long IV, but vitamin C IV has many, many, many properties that make it unique in helping you to recover from a virus infection. One of my girlfriends is a family practice doctor in New Orleans, where they've just had their epidemic little pocket. She treated 45 patients with IV vitamin C, and not one of them died. So excellent outcomes. I've had patients, Dr. Brownstein is a colleague of ours up in Michigan. He's been treating patients with IV vitamin C in his office, and not one of their patients has had to go to the hospital or died. So we feel very confident in this as a therapy. Of course, there will be some people that can't get through it, but we've been using vitamin C IV to treat viral illnesses for 10 years in my office, for 30 years in my colleagues' offices. So this is nothing new to us. And we know that just give your immune system a little bit of a push in the right direction, and it can handle a lot. There's another really...
I was just going to say one caveat on that, because, the authority of the physician, the skill of the practitioner is really, really critical. G6PD deficiency can cause complications with high dose vitamin C. So if we're going above 15 grams, we really
25.
25 grams?
We'll treat up to 25 with no G6PD. So these doses that we're using are really safe. So glucose 6-phosphate dehydrogenase deficiency is an enzyme deficiency mostly found in people of North African descent. And this enzyme pathway causes their little blood cells to burst open if they have too much oxidative stress. Well, oxidative stress happens during coronavirus cytokine storm. So vitamin C is antioxidant at a certain level and then becomes pro-oxidative at a higher dose. And there's some controversy about that, whether it's 15, 20, or 25 grams. In our office, we've used 25 with abandon. We've never had a problem.
Perfect. All right. That's excellent. All right. And Donna is saying we can't find vitamin C. I check in our store, Donna, and if not, email my team at drannakabecca.com and they can help you. We got a lot of praise. Elle says fantastic info. Let's talk. You said when you get, this is one of the things, maybe this is subliminal, a little Freudian slip here, but when you get coronavirus, let's talk about, what you're opening
how
up.
How often are you going to get it? So right now we think, based on the best testing that we've had, that somewhere between 1% and 2% of the United States is going to have coronavirus. So 98% of us are not even going to have it. And of those 1% to 2% who get it, 95% are going to do fine and convalesce at home. So it's a very serious and deadly disease for a very tiny population. And those people who are at greatest risk are already in a state of oxidative stress. They're acidic, they're low in oxygen, they're low in minerals, they're low in vitamins, their sugars are too high, they're high. They take a lot of prescription medications, which are drug muggers, and they're stealing all of these micronutrients. So by supplementing, we can dramatically reduce our deficiency state and improve our immune system. Because coronavirus, to me, really is just a symptom of a patient who was generally very sick to begin with. And this is one more straw on the camel's back that they were just unable to handle. There's a few rare exceptions to that, but for the most part, that's true.
Yeah.
And it's not very common. Our testing is a whole nother subject for a whole nother day, but there's one other supplement that I don't want to forget to talk about, and that's glutathione.
Okay. Right. We just on the side, don't forget y'all, selenium, magnesium, but now a biggie for supporting detoxification, glutathione.
Yeah. So, and glutathione is the mother of all antioxidants. Remember, we just said that this is a problem of oxidative stress. And what's happening deep in the lungs is the blood cells are bursting open and dumping their iron into the lungs, smothering the patient. So no matter how much ventilator pressure we put, we can't get them oxygen. So we got to prevent those little blood cells from bursting open. And the body has a pathway to do that. And that pathway is the glutathione pathway. So whether you're taking N-acetylcysteine, a precursor, liposomal glutathione, or something called PQQ, these are all ways that your body can resist the destruction that's caused by coronavirus.
You think about creating that healthy gate, that healthy boundary, that cell membrane protection, and supporting your body's detoxification pathway. So it is a fortifier, right? We talk about fortifying our whole body. Mm-hmm. And glutathione is certainly a fortifier. And on that note, too, just with the kind of that, why it's creating this ground glass, the comparison to altitude sickness in your minute on with us.
Yeah. Yes. I've got 1 to 2 more minutes. So altitude sickness is that condition where people go up high in the mountains and suddenly they can't breathe. Their lungs fill up with fluid. They become smothery. They're very frightened. They can't get enough oxygen. They're starving for air. And this treatment is just to get them down the mountain. And it almost all goes away unless you have access to certain prescription medicines, 2 of which we know of, commonly used. One's called Diamox and the other's called methylene blue. And so this is an IV medication, but they're started to show some very promising results to stop treating this like it's a smothery drowning condition, but rather treat it more like altitude sickness where the patient is unable to oxygenate. So it's very fascinating to think about how far we've come in a very short period of time, relatively speaking, in medicine. Historically, it took 7 to 10 years for something that was discovered in a chemistry lab to be turned into something doctors could use in their offices. Now it's taking like 7 days for people to make a discovery that gets on the internet, that gets a pre-publication that everybody reads, that people are now trying.
And the collaboration in the world, like the world scientists are collaborating around this. World scientists.
In a way,
sticking together in a way that we've never seen in our history. And that's impressive. That should be so comforting that we are working together. And that's a peace movement. Karen wrote, are there certain people or groups that shouldn't have the glutathione? I can't remember where I read it, and then I started being afraid of it. Maybe those with Hashimoto's or another immune disease. Glutathione, our body naturally produces glutathione. So we're supplementing additionally to it. I think with anything you can do too much, but we've given high dose IV glutathiones, and we do that to help support detoxification and fortify the immune system. Dr. Campbell, any
If there's a contraindication to it, I don't know it. Again, we're trying to get people who are deplete to normal, or maybe a little better than their normal, because there's an age-related decline in glutathione. So we want to have you the levels of a young person. And if we learn about something, we'll post it and see what we can learn. So I need to go. Anna, I like to hug you heart to heart. We have to do it virtually, heart to heart. Thank you for having me.
Thank you. And let people know where to reach you, where to connect with you. You just wrote a position paper on coronavirus. Should they email your team for their physicians?
Sure. Or post on our Facebook page, or call us at the Campbell Family Medicine office. We're on the internet. You can't miss us if you look for us. Thank you, Anna. Be well, everybody. And don't forget, soap, your number one defense. Wash your hands.
I keep thinking every time I say number one prevention, I want to say condoms. Your soap is Here we go. Right. Okay. Laughter, the best medicine. Thanks for this girlfriend time. Ellie, love you. Thank you.
Love you, girl. Bye.
Big hugs to the family. Bye. All right, you guys, that is Dr. Ellie Campbell, who joined me today. She is world renowned. Honestly, she has received more accolades and awards, especially as a integrative concierge physician. She is spearheading, has been a trailblazer in integrative medicine, and is definitely, as you can see, heart-centered, loving, clinically astute. She is a beautiful clinician. So I want to share with you too, you guys, as we close, don't forget to get your copy. So please get your copy of Keto Green 16 at dranna.com/Keto Green. And there's a bunch of book bonuses. Remember, we've got all these great book bonuses. So while you're waiting for Keto Green 16 to arrive, you are enjoying all these amazing bonuses and enjoying some of these recipes, like our feast recipes and quick start guide and some fun stuff. So definitely get your copy, dranna.com/Keto Green, to enter your receipt number into the book bonuses. We are also having the giveaway right now. So we are in the midst of the big book giveaway. So what we're doing is through April 30th, just snapshot your receipt, hashtag Keto Green 16 book giveaway, and you guys are entered in to win $1,500 in prizes. So I'm excited to share that with you. Really excited that my book is coming out and that you guys are here with me to join this. Karen says, I pre-ordered your book. Awesome. Thank you, Karen. Thank you guys for sharing this information. Again, emphasizing the importance of keeping our immune system strong. And that starts with getting Keto Green. As we end, I do want to look, as you know, I'm constantly looking at research and also looking at clinical data, but as I thought about this whole thing on altitude sickness, as Dr. Campbell was talking about, I mean, how interesting, right? Altitude sickness. And then I started thinking, when I was in Peru, in Machu Picchu, in Cusco and Machu Picchu, which is very high altitude. And listen, my house right now, 8 feet sea level. So to go up to 10,000 feet above sea level, that is huge. That's a huge adjustment. And many people get altitude sickness. So they tell you to eat the cocoa leaves and drink maca. So that had been seeded. I never made an association, but I'm going to share with you some pretty cool information about that right now. Is that, so I started looking into, was maca used? Let me show you where that is. I've got all my research up here. Well, also looking at antiviral activity of maca against human influenza virus. So there's some beautiful story, some beautiful information about that. And also the role of maca on serum interleukin 6, which is an inflammatory cytokine. So maca being anti-inflammatory helps with the cytokine storm that we're talking about with COVID. And looking at the research for this. But I really was so interested to see that adaptogens like maca, which is, has been also now studied for preventing altitude sickness. So I thought that was fascinating, probably because of its adaptogenic activity. But yeah, how cool, right? So all of you drinking my Mighty Maca Plus, do not forget, right? That is an essential and is what my kids are drinking too. But we really want to support our adrenals, not just because of the antiviral activity, right? Why it's so important is that we're right now affected by so much stress, hardships, uncertainty. We want to open up, but we know that there are people we love that are vulnerable to the influenza, to the coronavirus, and we're doing everything we can. So I want to encourage you to continue doing everything you can for yourself first, right? As you get healthier, those around you get healthier. They ask, like I'm having old friends, haven't seen in a long time, say, Dr. Anna, what are you doing? You look fabulous. You're radiant. You're healthy. I'm like, I'm healthy. I'm happy. I'm good. I'm like all these things. I walk my talk to the best of my ability. I walk my talk. And so that's what I'm doing here to encourage you to embrace your next right step. Share with me, and I will see you tomorrow. We got some fun things coming up this week. So I'm going to continue doing Facebook Lives during the weekday this week. And the goal is around 4:30 each day. So I have a great guest coming up on Wednesday, and we will be talking about, during this Facebook Live, we will be talking about the challenges, the fun, and the craziness of being a single mom. So as a single mom with 4 daughters and 2 female dogs, and being the sole provider for my family, it is there's some challenges I faced, and I know that there are other single moms that are really struggling right now. So I'll be posting the invitation for that call for Wednesday at 4:30, but just a little footnote to share again this information with friends, and especially single moms that or anyone who's at home and struggling, and that I can support. Thank you guys for being with me. Till next time, this is Dr. Anna Cabeca, your girlfriend doctor, signing off.